Good day, everyone. We stand at a crucial point in healthcare where technology often threatens to overshadow human connection. Our presentation today focuses on a Filipino-developed theory that masterfully bridges this gap. Dr. Carmelita C. Divinagracia's theory of composure behaviors, or simply the Composure model. This theory is a foundational work that proves the nursing profession's capacity to deliver care at a high caliber, demonstrating that advanced practice requires both technical skill and profound humanistic strategies. Our objective is to dissect this framework, proving that caring is not a soft skill, but a measurable, specialized intervention that optimizes patient outcomes. Over the next few minutes, we will explore the theory's journey, the formulation of her model, and its powerful application in clinical practice.
To appreciate the Composure model, we must understand its creator. Dr. Carmelita Divinagracia is a stalwart figure in Philippine nursing education and research. Her academic journey provided the empirical depth for her theory. She earned her BSN in 1962 from UERMMC and significantly continued her postgraduate studies, culminating in a PhD in nursing from the University of the Philippines in 2001. This was a career built on decades of hands-on experience from clinic and staff nurse to head nurse, instructor, assistant dean, and eventually dean of the UERMMC College of Nursing. This trajectory, moving from the bedside to executive administration, gave her a comprehensive view of nursing reality. Her influence extended nationally. She served as the former president of the Association of Deans of Philippine Colleges of Nursing and remains a key member of the CHED Technical Committee on Nursing Education, instrumental in defining national standards of competency. The Composure model is a truly the refined wisdom of an expert educator.
The Composure model is not abstract. It is research-validated. It emerged directly from Dr. Divinagracia's 2001 doctoral dissertation, Advanced Nurse Practitioners' Composure Behavior and Patients' Wellness Outcomes. The underlying thesis is clear. Specific, holistic nursing behaviors have a causal impact on patients' recovery. The study focused on advanced nurse practitioners, or ANPS, defined as licensed BSN graduates with specialized training at least 2 years of experience. This choice emphasized that expert-level holistic are demands both advanced technical mastery and refined behavioral skills. The population was adult. Cardiac patients admitted to the coronary care unit, a critical care setting where patient stress directly impacts outcomes. The research measured composure behaviors, the independent variable against patient wellness outcomes, or the dependent variable. The conclusion was definitive. ANPS exhibiting these behaviors significantly improved patient wellness scores. This validated the nursing profession's capacity to deliver quality, biobehavioral care that respects the patient's humanity.
The genius of this theory lies in its practical framework, captured by the acronym Composure. This is the toolkit for the advanced nurse practitioner. Let's break down the 8 essential behaviors. C stands for competence. This is the non-negotiable foundation, in-depth knowledge, and clinical expertise. Without this technical mastery, no amount of empathy will suffice. P is for presence and prayer. Active listening, therapeutic touch, and if culturally appropriate and accepted by the patient, offering a quiet prayer. This institutionalizes the nurse's role in addressing spiritual distress and fostering hope. O is for open-mindedness, being receptive to new evidence and flexible in accommodating the patient's preferences, thereby promoting their autonomy. S is for stimulation, providing encouragement, guidance, and complementary works to activate the patient's psychological resources for recovery. U is for understanding, showing genuine empathic comprehension by reflecting the patient's information back to them, making them feel heard and reducing anxiety. R is for respect and relaxation, valuing dignity and employing calming measures. This directly mediate the physiological and stress response. And finally, E is for empathy, the ability to truly put oneself in the patient's place to understand their internal thoughts and feelings. These 8 behaviors work synergistically, confirming that high-quality care is blend of head, hands, and heart.
A nursing theory strength as assessed by how we address the core concept of meta-paradigm. First, the person. Dr. Divinagracia defined the person as the individual, universal needed, humanly, caring and spiritually oriented intervention regardless of creed of social class. Second, nursing. It is an active professional discipline provided quality care through the composure intervention building a pivotal relationship characterized by trust and acceptance. Third, health. It is a dynamic state of well-being measured by coordinated, integrated living pattern. Finally, environment has initially noted as not state. However, its application implies environment is the immediate micro-context of the nurse-patient interaction which the nurse must modulate to be therapeutic.
The composure model truly comes alive when applied to real patients. Let's look at the 2 brief scenarios that demonstrate how a single coordinated intervention can achieve both psychological and biobehavioral outcomes. Scenario 1 summary. Consider Mr. Delgado, the post-MI patient, overwhelmed by a new insulin regimen. The nurse ANP Sarah didn't just give instruction, she used understanding to validate his fear, and then she integrated competence with presence and prayer. This holistic response, addressing the spiritual crisis alongside the technical challenge, resulted not only in reduced emotional distress, but also the measurable stabilization of his rate.
Nurse Ayana senses Junko's distress and immediately applies the principle of presence. She sits beside him and makes comfortable, sustained eye contact, creating an atmosphere of calm and attentiveness.
I don't know how I'm going to do this, nurse. Sobrang hirap. The doctor gave me all these shits about insulin. And I am so confused about these all needles. Everything is just too much. Parang feeling ko pinaparusahan ako.
Chris, it sounds like you're feeling overwhelmed right now. Not just by your heart attack, but also by this new diagnosis and the confusion about insulin. Tama ba ako? Is that right?
Nurse Ayana's gentle questioning and active listening demonstrate understanding, confirming Junko's fears and allowing him to feel heard.
Yes, exactly, nurse. I feel so lost. Di ko alam kung saan ako magsisimula.
Nurse Ayana decides to address the immediate source of anxiety with competence. She knows that hands-on demonstration can be more effective than simply discussing the abstract instructions.
I know this seems daunting, Chris, pero we'll go step by step. I have 15 minutes right now dedicated just to you. You can go slowly. Kaya natin to.
She slowly demonstrates how to load and use the pen, explaining each part clearly.
See, hindi siya masakit. Hindi rin siya kasing komplikado ng iniisip mo.
As she explains the mechanics, Nurse Ayana observes Junko's praying silently, prompting her to address his spiritual being, another aspect of presence.
Kung nagdadasal kayo kahapon, Chris, do you draw some strength from your faith during times like stress, like this?
I do, nurse. Malaking tulong ang faith ko. I just wish I could some peace right now.
Nurse Ayana responds with empathy, using therapeutic touch as she briefly places her hand on his arm, a gesture of comfort and solidarity. She then offers prayer, further addressing his spiritual distress and reinforcing her presence.
We can say a short, quiet prayer together kung okay lang sa'yo.
Yes, please, nurse. Maraming salamat.
Nurse Ayana bows her head and offers a brief, quiet prayer for strength and peace. After the prayer, she continues to discuss the insulin pen, answering any remaining questions. After the prayer and focused discussion, Junchris visibly relaxes. A review of his continuous cardiac monitoring shows his heart rate, which had been fluctuating between 95 and 100 beats per minute, stabilizes at 82 beats per minute. This intervention resulted in both a biobehavioral outcome, or reduced emotional distress, and a measurable physiologic outcome, the stabilization of vital signs.
Scenario 2, Summary. In our second scenario, Miss Lim, post-TKA, refused therapy due to pain. A and B, Michael used understanding and respect to validate her fear. Crucially, he employed open-mindedness by proposing a flexible, collaborative plan for a reduced ROM by making the patient a partner in her care. He resolved the non-compliance issue, leading the functional progress and reduced anxiety.
Good morning, Nari. Time na po to increase the range of motion of your CPN machine. From 60 degrees, we need to go to 65 degrees. Ready ka na ba?
No, Hans, absolutely not. Ayoko. It's too much pain. Ang sakit. That sharp pain is back and I won't do it. It feels like my knee is breaking. Hindi ko talaga kaya.
I hear you, Mary. Nararamdaman ko ang sakit mo. That pain you feel is very real, and we need to respect that boundaries. You are worried that pushing the ROM will cause you lasting damage. Is that correct? Natatakot ka na baka masira ang tuhod mo.
Yes, exactly. I'm so scared, Hans. Parang mapipilay ako lalo.
Miss Lim, the increase is crucial for your recovery.
Mary, I understand your concern. Let me check your medication chart.
Most people just check.
Okay, I see your pain medication is due in about 30 minutes. What if we adjust the plan? The current order is for about 65 degrees, but I propose we respect your discomfort for now and start at 55 degrees. A small step forward. Maghintay tayo until your pain medication is fully active, and then we will try 55 degrees 15 minutes later. Not 65. If you are comfortable, we can evaluate later.
What's happening? Are you okay?
Hi, Kate. Mary is expecting some pain in the CPM, so we're adjusting the plan to ensure comfort and compliance.
Good job, Hans, addressing the pain first.
You have made excellent improvements since yesterday, Mary, and you handled the situation reigning so well with Carlo. That takes courage. This temporary discomfort is just a step forward, achieving your goal of walking independently again. Alam kong kaya mo yan.
Yes, Mary, you've been doing great. This small step is a big deal.
Kaya mo po yan, Ma'am Mary. Kunting tiis pa, malakas ka naman po. Okay, Hans, sige. I'll try that 55 degrees after my pain meds.
These principles lead us to the next step, critical application on your screen. Now are 5 thought-provoking questions designed to assess your comprehension and analytical rigor. These questions challenge you to analyze the ethics of presence and prayer, critique the model's generality, to fast-paced settings, and discuss the interdependence of competence and empathy. The theory of composure behaviors is a powerful mandate. It demands that nurses not only master complex medical procedures, but also integrate profound humanistic attributes. It ensures that the nurse remains an expert therapeutic agent in the patient's recovery process